Hi, I am Dr. Sridhar K, consultant neonatologist and pediatrician. Welcome to my channel. In the previous video, we had reviewed medical training during my training days. In this video, we'll have a quick overview of what has changed in the recent years. Obviously, I don't have first-hand experience. It's based on what I hear through my niece, who is a final year medical student in India, and my daughter, who is a first year medical student in UK. Medicine as a whole has evolved a lot in the past 30 years since I started medicine. Lots of advances in different fields of medicine. Genetics, the human genome has been deciphered as a whole, and the ability to split the genes. For example, now we have the RNA and DNA based vaccines for the COVID-19 virus within no time of the infection starting. This was unimaginable in the previous days. Also, the vehicles for testing such vaccines have improved a lot. We know a lot more about the mechanisms in our immune system, in our genetic system, and so on. So we have many disease modifying agents which are based on resisting the cytokines, which are part of the inflammatory pathway. We have many medicines which base on inhibiting the second messenger pathways of enzymes and hormones and so on. So these advances were just starting to happen when I was in medicine. One of the main aspects of training that has changed is the focus on clinical aspects. So right from early stages of training, you are involved in clinical training. You start learning more about the correlations of a problem with the clinical correlation much more early in your course. You also start shadowing clinically. My daughter, for example, she has gone for some orthopedic clinic shadowing right from the first year. When she is learning about bone, she starts going to the orthopedic clinic and so on. Of course, the COVID-19 pandemic has changed things a lot. There are lots more webinars happening. There's one advantage of these webinars, that they're all recorded, or most of them are recorded. So even if the student happens to miss a little bit because of distraction or any aspects, we have ability to rewind or catch up, and you can also ask questions to your lecturer after the session has ended more comfortably, because you have the online platform where you can put messages. So this is one area that has improved. We also have an important change in that there is more focus on communication skills. So obviously communication is very important in medical training, and communication skills have a lot of focus these days. I mean, previously when we were training, communication was not stressed on, and that is very important area. We improved after I went to UK, for example, that my focus on communication skills came up after that stage. Now they have incorporated into medical training even in India. So it's very important for doctors to be good communicators, and unless it's imbibed into your medical training, it's difficult to encourage you to learn more about it during your practice itself. Of course, you always learn from your teachers, and it's very important for the teachers in the medical colleges to set an example for the students as far as communication skills, work ethic, and everything else is concerned. Ethics is the other important aspect that gets more stress on. In UK, for example, even in your interview for medical university, there are medical questions both in the entrance exam, the written exam, as well as in the interviews. So the student is given scenarios where they are expected to understand and respond to situations like consent taking, ethics of refusing a procedure that they have been offered, the ethics of deciding when a patient cannot decide for themselves, and all these aspects are very important. And if you start incorporating it early in the curriculum, it's obviously better for the student to understand. The length of the course varies depending on the university you choose to. The model of assessment may vary depending on the university you choose to. But one of the main improvements I've seen is reliance on independence of the student to learn. So lecture based or didactic learning is moving away from make more of discussions, more of combined approach to learning. So you have student-led learning as well as lecturer-led learning. A combination is always better, and most of the universities are following that. So you have small group discussions where the student prepares and leads a discussion, and you have the lectures. So it's not just the lectures which we used to have when we were students. We used to have the clinical sessions, of course, which was like a small group discussion, but there again, one of us used to take the history and present the case and examination findings, and the teacher or the lecturer would lead us on from there. There was more focus on theoretical learning in those days. Now we have more focus on practical learning, clinically relevant, and all of us know that we don't need to memorize the dose of medicines anymore. We always refer to the formularies again for safety reasons, so you don't make mistakes from memory-based drug dosing. Unless you're very experienced and you've been using a medication repeatedly, it's safer to refer to the formularies. And that is also stressed on that rote learning is going out of vogue. So even the exam questions, the multiple choice questions, for example, they test you more, and they are looking at practical aspects of how you apply your learning in medicine. So different systems use different approaches, and you have dissertations, you have ability to present papers. So some of my friends' daughters who are studying in medical university, they've already presented papers in conferences in the second or third year, and I didn't present any paper during my training days till I was doing my post-graduation, and during my DM days was publications that I started making. Of course, we used to have less access to journals, and because we used to have to go to the library, and a certain section of the library which used to be very dusty with the old journals, we used to rummage them. Now the students have the access of the internet. Most of the universities offer a very broad database access, and this is a blessing for them, because anytime they have a doubt, they can straight away refer to the original source, and most of the journals are available for them. So these are huge changes that would benefit their learning. Of course, the presentations that they make early in their career, the PowerPoint presentations, improves their confidence in public speaking. They're speaking to their colleagues, but at the same time they're also preparing for facing questions based on what they are learning, and they're expected to learn a little wider than what is actually given in the textbooks. So if they have a question from what they read in the textbook, or they think something could be represented differently, they read about it and then they get back to it. So I'm very impressed with the training that my daughter has received so far in Oxford University, and most of the UK universities probably follow a similar system. And my niece who is in Ramachandra Medical College in Chennai also is full of praise for the approach. The COVID hasn't made a huge impact for the non-clinical teaching. However, it has impacted the clinical teaching, because they're missing out on the sessions when they attend and examine patients. Of course, you have simulation-based learning, which has come up in a big way, and that may reduce the stress to some extent. For example, they can practice without fear of harming the patient to suturing skills, and they can also dissect on a simulation basis, so you don't need to use the cadavers as much as we used to need. So surgical training, skill training, even cannulation skills, intubation skills, these have almost high fidelity realistic models. Simulation models are coming up. Of course, these are expensive, not every center can have it, and there is a lot of focus on simulation training as well in once you complete your training as well, to keep your skills up. So all these are advances in medicine that have changed the way we approach training. So this is just a quick overview based on my own views, and if you have any comments, please do share your views as well. I hope this is useful. Do share. Thank you.